Today we will discuss influenza, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Influenza, commonly known as the flu, is a contagious virus that affects your respiratory system. It can cause symptoms like fever, a high temperature, a dry or productive cough, sore throat, pain or irritation in the throat, runny or stuffy nose, nasal congestion or discharge, body aches, muscle or joint pain, fatigue, feeling unusually tired or weak, headache, pain in the head or forehead, chills, shivering or feeling cold. How to know if you have the flu. 1. Symptom onset. Flu symptoms usually come on suddenly. 2. Fever. You may have a high fever, often above 100 degrees Fahrenheit. 3. Duration. Symptoms typically last about a week, but fatigue can linger longer. 4. Contact. If you've been around someone with the flu, your risk increases. If you think you have the flu, it's a good idea to rest, stay hydrated, and consult a healthcare professional, especially if symptoms are severe or you have underlying health conditions. If someone has the flu, here's what to do. 1. Rest. Encourage them to get plenty of sleep. 2. Stay hydrated. Drink lots of fluids like water, soup, or herbal tea. 3. Manage fever. Use over-the-counter medicine like acetaminophen to reduce fever and aches. 4. Stay home. Avoid contact with others to prevent spreading the virus. 5. Eat light. Suggest simple foods if they feel up to eating. 6. Consult a doctor. If symptoms are severe or last too long, see a healthcare professional. These steps can help ease symptoms and support recovery. In the hospital, if someone has the flu and needs help, doctors and nurses may 1. Check vital signs. Monitor heart rate, temperature, and breathing. 2. Provide oxygen. Give extra oxygen if they're having trouble breathing. 3. Fluids. Administer fluids through an IV to prevent dehydration. 4. Medications. Give antiviral medicines to help fight the virus. 5. Treat symptoms. Use medicines to reduce fever and relieve pain. 6. Monitor closely. Keep a close watch for any worsening of symptoms. These steps help manage the flu and support the patient's recovery. Here are some commonly used medications for treating influenza. 1. Antiviral medications. Oseltamivir, Tamiflu. Taken as a pill or liquid, it helps reduce the severity and duration of the flu. Zanamivir, Relenza. Administered as an inhaler, it also helps fight the flu virus. Piramivab. Given as an injection, it's used for treating flu in some cases. 2. Over-the-counter medications for symptom relief. Acetaminophen Tylenol reduces fever and relieves aches. Ibuprofen, Advil, Motrin, another option for pain relief and fever reduction. Cough suppressants, such as dextromethorphan, Robitussin DM to help with cough. Decongestants, such as pseudoephedrine, Sudafed to relieve nasal congestion. Always consult a healthcare professional before taking any medication. People at increased risk of developing the flu include 1. Young children. Their immune systems are still developing. 2. Older adults. They may have weaker immune systems. 3. Pregnant women. Changes in the body can make them more vulnerable. 4. People with chronic illnesses. Conditions like asthma, diabetes, or heart disease can increase risk. 5. People with weakened immune systems. This includes those undergoing treatments like chemotherapy or taking certain medications. 6. Obese individuals. Higher body weight can increase the risk of complications. These groups should take extra precautions during flu season. Now you need to watch my video on COPD or have a look at pneumonia.